Hi everyone, I want to talk about sore throat treatments. If you are just listening to my presentation on sore throat or pharyngitis, then I would advise that you please check the first presentation on the clinical features and the second one on the diagnosis, so that you can get a clearer picture of what sore throat is all about in total. Okay, let's go. Okay, when it comes to sore throat treatment, we'll first of all think about the possible etiology, mostly caused by virus, but it could be caused by bacteria, and is otherwise known as pharyngitis. First thing first, rule out terrible possible complications like epiglottitis, which is an acute emergency, peritonsillar abscess, submandibular infection, or submandibular abscess. However, possible HIV infection, or retropharyngeal infection, or retropharyngeal abscess. Rule all of them out, then you can settle down for the following. So if you are convinced it's not bacteria and there are no complications, then let's go ahead with oral analgesics, topical therapies, environmental measures, warm fluid, tea with honey, soups. Avoid a dry environment, avoid exposure to smoking, reassurance, and educate the patients on why you will not be administering antibiotics. Why will you not be prescribing antibiotics? Let the patient know. Ask about patient preference based on the past medications used. Rule out certain comorbidities before starting certain medications. For example, rule out peptic ulcer disease because it's likely you are going to advise the patient to take non-steroidal anti-inflammatory drugs. Then you can go ahead with your Ibuprofen or Aspirin, Acetaminophen. Dexamethasone is controversial with some people, but I'm okay with that. Dexamethasone 5 to 10 milligrams, stop, just one dose. You can apply topical therapies, and that could be in form of lozenges with menthol containing lozenges. There's a quinine, for example, sucrase could be used. Benzocaine containing spray are contraindicated because of a possible fatal outcome, but could be used if it is at a lower dose, like 1.5 milligram to 5 milligram. Azithromycin, lidocaine hydrochloride, abruzole could be used. You can also use fluproprovin lozenges or ibuprofen lozenges. You can use throat sprays that contains phenol, benzocaine, chloroacetic, but be careful, chlorhexidine, benzodiazepine hydrochloride is an anti-inflammatory agent, e.g. Deflan. Lastly, you can encourage the patient to take warm soup or warm food. No rough or craggy foods, smooth or fine textured foods are better. Honey is fine, tea is good. Popsicles, ice cubes, and so on. Remember to use humidifiers and avoid smoking or secondhand smoking. And with that, I come to the end of the presentation as far as sore throat or pharyngitis is concerned. Remember, if you've ruled out possible complications on account of which you might refer the patient to emergency room, and you are still suspicious of bacterial infection, just do your throat culture and place on antibiotics. But if not, if it is viral, then you can embark on all these measures. Kindly subscribe to my channel and you'll be able to get my presentations immediately they're published. Thank you.